Welcome to Kilkenny, Ireland's first age-friendly city and one of the leading lights in the Irish age-friendly movement. We're a county synonymous with the sport of hurling, culture, crafts, agriculture, and one of Ireland's go-to tourist destinations for both Irish and international travellers. Since 2009, many people have helped to develop Kilkenny as an age-friendly city and county, and this video celebrates key milestones on the journey to achieve that status. We meet some of the people who have contributed to the successful delivery of numerous initiatives during that period. From the outset, the vision of the programme was and remains to make Kilkenny a great place in which to grow old. The age-friendly city concept was conceived at the World Congress of Gerontology and Geriatrics in Rio de Janeiro, Brazil in 2005. That Congress identified a need to plan for an older society which was growing globally, with 22% of the world's population expected to be over 60 by 2050. An age-friendly cities guide to assist cities to become age-friendly was later produced, with a consideration of age-related matters taking on a broader meaning. The Kilkenny Age-Friendly County Alliance was established on an interim basis in 2009. Its key role was to commence Kilkenny's Age-Friendly County programme. The Kilkenny Age-Friendly County Initiative was formally launched by well-known Hollywood actress Maureen O'Hara at a seminar held on the 26th of March 2010 in Hotel Kilkenny. At the first international conference, Building the World Health Organization Global Network of Age-Friendly Cities, held in Dublin in September 2011, Mayor David Fitzgerald signed the initial declaration on behalf of the citizens of Kilkenny.
The Kilkenny listening workshops or consultations that were conducted back in 2010 were really the first consultations that were conducted in Ireland. And I think we had 22 workshops, and it was really about finding out what older people wanted themselves. So we took the WHO framework around the 8 themes of age-friendly cities and communities, and we gathered in community halls, public houses, parish halls, and there was a great turnout, about 700 people, I believe, in that first consultation round. And people spoke about all elements of their engagement with service users, their health services, transport, housing. And really, it was the first time, I think, that older people in Kilkenny were given a voice to inform the strategy and the policies that would invariably be rolled out across the community. The Kilkenny Age-Friendly programme was quite unique because the collaboration across the service providers and the local government agencies was very strong from the outset. And particularly to Kilkenny was the engagement with the HSE, which really provided a multidisciplinary approach to the activities. So rather than the different aspects of age-friendly operating in silos, there was genuine cooperation across the agencies from the local authorities, the Garda, the HSE, and that was a unique aspect to Kilkenny's programme from the offset. And it really did, I suppose it embedded the programme and made it very sustainable. There's a lot of work that has been done here in Kilkenny that is unique in its nature, unique in its collaboration, and that has been replicated across the globe. Because for a lot of people, the ability to stay living in their own community is foremost in their mind. So I think there'll be more opportunities for social engagement, and there'll be more opportunities to remain living in your own community for much longer than is at the moment.
The vision of the Kilkenny Age Friendly Alliance is quite simply stated. We want Kilkenny to be a great place for our citizens to grow old in, with respect, dignity and inclusiveness. I'm delighted that Kilkenny Local Authority was one of the first local authorities in the country to take on the Age Friendly programme and to demonstrate that commitment over the last 10 years. I think we've transformed our whole environment, the way we approach the delivery of our local services, the way we plan and design our infrastructure, our housing, our streetscape. Everything is more accessible now as we take into account the fact that our population will age over time.
We had a great relationship from the very beginning with the Kilkenny County Council. Extra parking spaces for older people, specifically for older people. The public WC on the parade, that was just wonderful for older people. Street furniture enabled people to sit and stare and just look. And it brightened up the city.
I'm delighted that the Age Friendly programme is front and centre in the delivery of all of our services, and we do take account of that. And as the incoming chair of the Age Friendly Alliance, I want to ensure that we will commit to continuing to do that, to make Kilkenny a better place for our citizens as they grow older.
Over the past decade, members of the Kilkenny Older People's Council have been to the forefront in promoting numerous initiatives which have benefited the older citizens of Kilkenny City and County.
Kilkenny Older People's Council is a community group. Its role is to articulate the voice of older people so that the needs of older people are considered by the key service providers in the planning, design and delivery of services across the 8 World Health Organization domains. And they are outdoor spaces and buildings, transportation, housing, respect and social inclusion, social participation, civic participation and employment, communications and information, community support and health services. We do that through the Age Friendly Alliance and on other committees and forums on which we are represented. To articulate the views and needs of older people, we hold facilitated workshops and listening exercises. The current programme of workshops is of particular relevance in that the views and needs expressed by older people will inform the third Age Friendly strategy, which will be prepared next year in 2023.
One of the key areas that I wanted to kind of bring in was to connect people digitally, and they had started that programme in the libraries, and it kind of transpired then with COVID and everything that was one of the most important areas to build on. The structural changes are very evident around Kilkenny City and around the county as well. The libraries have been very good in trying to, activities and things for older people. The creative side, like the arts and culture, that's been promoted, which is very good for, to keep an older person's mind active and engaged. And also you have the sports partnership, and a lot of older groups are encouraged to connect with them and to take part in those. So I think there's a lot of new initiatives going on for older people. Older people are going to have to engage kind of through the internet and things like that. And that is hugely important because an awful lot of areas in the county haven't got good broadband. The other thing is good rural transport, like to get people from one place to another and to mix, because that social side of things is really important. And I think that the rural transport system will have to be really updated. The Older People's Council, while I was chairperson, we heard, I had seen the age-friendly tablets. There were Acorn GrandPad tablets. There were tablets that could be used with, they had a SIM card, so people didn't need to have broadband or internet in their own homes. And the tablets were made, they were designed specially for older people, that there was none of these, the way that you get advertisements and things like that. And they were user-friendly, big writing on it, and the apps on it were big. And the apps could be downloaded like to suit the person, say like local newspapers or local radio, or the death notices were very important for an awful lot of the older people. like they got used to using them using those tablets because they were able to handle them. They weren't small, they weren't finicky, they kind of, and yet they were connected. Another area that they had was some people played bingo on them and some played bridge and stuff like that. Where older people have family that are abroad, the technology, they were able to connect. There was one person in particular that had connected with family in Australia and he was living alone here, and through all that, the lockdown and all that, he was able to connect, and it made a huge difference to his life.
Thomastown, I suppose, was always a very nice place to come in. It's our local town. All the local groups came on board and helped out the ICA, the Men's Shed and the senior citizens. So they all had an input in it. The local businesses came on board and they became age-friendly agents. The local food store and the pharmacy, the police station and the local hospital. They were all very delighted to be involved, to make Thomastown a better place for older people. Everybody is more conscious now of the needs of older people and take that on board.
Good health is crucial to our quality of life, and perhaps more so in our later years. Those involved in delivering health services to the citizens of Kilkenny have been leading the way in how they interact with and support older people.
Healthy ageing, I suppose, like health promotion, means enabling you to live your best life so that you can age in your own home, preferably, with the people around you that you love, and maintain connections with your community. So over the years, I've delivered a number of courses to older adults. Two of those are age and opportunity courses. One is called Taking Stock, the other is Aging with Confidence. Both of those look at where you are in your life in terms of physical changes, emotional changes, how to deal with difficulties, how to build your resilience. The outcomes of the courses were varied. They learned more about their health, they learned more about building resilience, but they also made connections, and I think that's one of the really important things. Face-to-face courses were the most powerful. So for people to be actually in a room together, for me, it was a huge success if at the end of the programme they started to exchange phone numbers or share lifts. That was a huge outcome. So connections, so important. In each of the consultation process, ageing in your own home was mentioned lots of times by older adults as something that was really important to them. So for the HSE and other agencies to provide those supports is vital. Now, some people who live alone or are isolated may want to move into assisted living or into nursing care, but the majority of people really do want to age in their own home.
In Ireland, the Department of Health and the HSE are working together through the Sláinte Care programme to provide new models of health care that enable people to stay healthy in their homes and communities for as long as possible.
So over the last number of years, Sláinte Care have put a huge emphasis on community care and keeping people at home for longer. So they have a vision to set up 32 integrated care specialist teams in the community, and Garda and County Council is one of them. We have 12.5 staff working on our team presently. We're a community specialist team providing care for people over the age of 65 with complex care needs ranging from dementia to frailty and a history of falls. So the whole idea behind our specialist team is that we work with our colleagues in primary care and the acute services to try and keep people at home in their communities for as long as possible. And it is imperative that we share information with our acute colleagues, with our primary care colleagues. So integration is key to the delivery of this service and the development of this service. Family members who have concern for their older loved one can engage with our service, and they have a holistic assessment ranging from physio to OT to nursing to medical, all in the one appointment. It saves people multiple trips in and out to outpatients. People are seen in a timely manner as close to possible to their home. Patients will be assessed at their initial visit, and then 1 month later there'll be contact made with them to see if their outcomes have been achieved and quality of life has improved for these patients. And again at 6 months we'll be looking. So for example, if somebody is having a history of falls, we'll be linking back with them to see, has our intervention made a difference to their life?
The Age Friendly Hospital Initiative started in 2016 As chairperson of the Older People's Council, I contacted the hospital, the general manager and Slattery, about working together to develop the age-friendly hospital. I was aware that they had done a lot of work with older people and that they had a great interest in trying to achieve age-friendly status in the hospital. When I approached Anne, she was very receptive to the idea, and she agreed that we would meet up. We also had the support of the National Age Friendly Office in Dublin, and they gave us some guidance on how we would proceed. The actions from the study were short, medium and long-term actions. And the idea was that we try and do some things that, were very visible and that were easy to achieve. The hospital was very supportive and really worked very positively with us. It was a very positive experience because we had a great engagement from all of the hospital staff and a huge commitment from them and an eagerness to work with the older people to try and make the hospital as age-friendly as possible. It's an ongoing exercise, and we are now getting back again to looking at what further actions can be worked on to try and make the place even more age-friendly.
Our General Manager was approached by the chairperson of the Older Persons Forum in Kilkenny with the view to setting up an age-friendly group in the hospital. At the same time, we had a patient partnership forum, and sometime previously, one of the members of the patient partnership forum spoke very eloquently at one of our meetings about how his wife had died here in St. Luke's in a busy ward with a television on in the background, and it was far from ideal, I suppose, the circumstances around that, and that prompted us to kind of think about what we needed to do. The first part of our age-friendly process, I suppose, really was to look at our own systems and our own physical environment and what it was about our hospital that we could improve upon. We used the Age Friendly Ireland Walkability Audit tool, and we identified 5 key locations in the hospital which would be used, mainly when people would come in, say, for example, our acute medical assessment unit, our X-ray department. We had somebody find a patient on a ward as if they were coming in as a visitor. We followed that up then with focus groups. Again, Age Friendly Ireland helped us out with those. We had held those in Carlow and Kilkenny. And I suppose that kind of drilled down further into the issues that people faced when they came to the hospital and how they felt we could improve our physical environment. There were quick wins, in terms of buying beam seating, for example, for the long corridors. We put in 2 soft armchairs into the emergency department waiting room, so for older people that they weren't sitting on hard seats. And I suppose then the other side of it was some of it was going to take some more resources.
As you probably know, the hospital opened in the 1940s, and it was dealing with a different population in that the age group would have been much younger actually coming into hospital, and TB would have also been a big thing to the fore. Whereas now over 70% of our patients are elderly patients, and we do have to put in a lot of supports to try and ensure that they have a good experience in their hospital. It is bad enough having to come into hospital, but then having to, if the environment is not good enough, if they don't have supports, it can be very hard on them. And we work very closely with the Age Friendly initiative here in the county to try and improve the overall experience for everybody. One of the big things is people were getting lost in the hospital, so we have improved the signage and we have markings on the floor. We also have markings for people that are visually impaired. The other thing we did was we put in a lot of seating. People maybe can't walk as far, so it's really important to have seating at various places. One of the great initiatives too was the transport initiative. Now we have the bus stop in the hospital. Many people have to travel to the hospital, and it's quite difficult trying to get parking.
The biggest thing that we were able to get off the ground was the bus service. That was really appreciated, especially for people going out to the hospital.
I suppose we were finding a lot of older people were being admitted to hospital, and some maybe unnecessarily. They were frail, but they needed supports, and perhaps hospital wasn't the best place for them to be coming in. So now we have the GEMS programme at the front door.
GEMS stands for Geriatric Emergency Medicine Services. It was set up by Dr. Emer Ahern, who was the lead geriatrician in St. Luke's Hospital at the time. She was the main driving force behind this new initiative.
It was recognised by the HSE that we needed to create a system that supported older people as soon as they came into hospital. And the person who did this in St. Luke's was Dr. Emer Hearn. She provided excellent leadership. She facilitated the development of our GEMS front door team, and she brought on with her many of key disciplinary members who are still working. And so not only did Emer provide a leadership, but she provided a pathway for that care to continue and a pathway for other therapies to work with patients after she had gone.
I'm a clinical nurse manager. I lead and manage the GEMS unit, which is currently a 24-bedded unit in St. Luke's Hospital in Kilkenny.
A patient presents to the hospital. They are screened for frailty or potential frailty. And we get an alert as part of the front door team or the emergency team to come and assess that patient. So we complete a comprehensive geriatric assessment, which contains about 5 domains. We're looking at their physical, emotional, psychological, medical and environmental needs. So we'd have extensive engagement with family members because we would always get collateral from both the patient, their family and anybody else involved in that, the person's care.
Any concerns that are brought up by the family or the patient themselves is passed on to me. So I take over the vulnerable or complex issues. I then follow that patient through their journey in the hospital. And my role is to talk to the patient to see what their wishes are, what they want to do, and then link in with the family, with the medical team and the nursing and OTs, physios, everything else to make sure that we try and achieve the outcome of getting a patient home as quickly as possible and with the supports they need. We maintain a lot of data, all right, and it gets fed up to the integrated care programme for older persons nationally as well. We like to keep our rates of admission to nursing homes down to the minimum, and up to this last year, less than 5% of people admitted to our hospital ended up in a nursing home directly from here.
They may have a medical diagnosis, but also they need many other of the specialties. There may be mobility issues for the physiotherapist. There may be needs at home for occupational therapists. They may be on too many medications or too little medications. There may be pharmacy. So once you recognize that somebody comes in, then what you need is you need to activate the system to work within 24 hours of them coming into hospital, because then their journey in hospital is a much shorter journey, and you're always thinking, okay, what needs to happen for this person to go home? What are their wishes? What's the support? What do the families want? So it's moved from just a very simple what's the diagnosis, which was a purely medical model, to actually understanding that you stand back and say, who is this person? What are their needs now? What are their wishes? Who can we bring together to try and get them better and get them home?
Obviously, the patient is treated. The reason that they're in hospital is usually because they're acutely unwell. Infections are treated. They get their therapy inputs. We encourage getting up and getting dressed.
So the NPJ paralysis is quite a simple concept. If people stay in their pajamas for long periods of time, any more than they need to, they're at risk of deconditioning, which is loss of strength and fitness, and subsequently end up with longer stays in hospital, which can be prevented and are sometimes unnecessary. So by us getting people up and out of bed and moving earlier on in their acute stay, we are actually reversing that concept, and we are having people participate in their own rehabilitation in order to reduce their length of stay and to make their journey through the acute sector a better experience. The impact on patients and their family members is that people are returning home quicker and also in better condition.
As you know, it can be very hard to get out of a ward. So one of the things they have noted is that if people get up, put on their clothes, even if it's to sit at the side of the bed for the day, that's an activity in itself. And it certainly supports people to getting out of hospital faster.
We're asking people to think about what's in your hospital bag before you come to hospital, so that you're not only bringing your pajamas and your slippers, that you're also bringing your daytime clothes, and that you're actively participating in your own rehab whilst in hospital to improve your outcomes and to make sure that you get the right treatment at the right time.
Before, it was all funneled up to one or two senior decision makers. when actually what we've done now is we've recognized that there's such a volume of people, we need to move to an interdisciplinary approach. So not only is it multidisciplinary, where different therapies are involved, but actually it's interdisciplinary, where everybody makes decisions on behalf of the patient. We're happy to back our older people. We're happy, when I'm an older person, I would like someone to respect my wishes. And so it's very important for us that we respect the wishes of every older person.
I think the age-friendly initiative here in Kilkenny has been massive. And I think with the people that have been on the main committee and the subcommittees and the county council and the hospital and all those people feeding in, they've done quite a lot of work. It may be small initiatives, but they've such a huge impact on people.
Memory Matters was a 2-year community-based project which aimed to prolong the period of community living for those with dementia and particularly those with complex needs.
Memory Matters was a project really that came about when we started looking at the viability of keeping older people at home, particularly those with late stage dementia. It was a project that was funded by the HSE and Genio Trust under the services reform. So it was really a look at reforming what was available to people in the community, to people living with dementia, to their carers and to those that provided the service to them. The Memory Matter project, it was a very diverse project to start at. We looked at older people. 67% of them were over the age of 80, 67% were female. And we know this is the cohort that would be predominantly living in the community with dementia. They were primarily people in the late stages who hadn't previously had access to things like daycare, things like home help. And to that end, the carers were actually kind of almost suffering burnout. So the next stop for a lot of these people living in the community was actually nursing home care. So at that stage of their journey, they were recommended by the community geriatricians as suitable candidates for participation in the Memory Matters project. All in all, across the project, we provided the equivalent of about 21,000 extra home help hours to those individuals living at home. And over the course of the project, we tracked the progress very meticulously and very carefully. And we actually found that over the course of the project, those individuals were actually maintained at home for the equivalent of about 15,000 extra bed nights. So there was an awful lot of learning that has been replicated, and there's an awful lot of practice that has been embedded in the delivery of care for those living with dementia. And I think it has proven as well the cost effectiveness of transferring care back into the community rather than in a very expensive acute or residential setting. And I like to think that in some way that influenced or at least was timely with the Sláinte Care package of care as well, which looked at moving patients to the lowest point of acuity in terms of back to their community, back to where that support was available.
The Kilkenny Age-Friendly Business Programme began with the Kilkenny Ormond Hotel and has been significantly advanced in recent years by the McDonagh Junction Shopping Centre, which is Ireland's first age-friendly shopping centre.
The age-friendly programme was very much in line with our ethos here. We were approached in 2016 by Nicky Brennan and asked to become an age-friendly business, and for me it was very important that we took the project on board. So we looked at our business from an older person's perspective and we implemented small changes that make a big difference. Those changes in this common area of the shopping centre included dedicated seating, lowered music volumes, an age-friendly discount club, age-friendly parking, as well as comprehensive training for all our staff. But then we went one step further and we invited all of our retailers to take part as well and for them to become age-friendly businesses in their own right. And the objective is to make the shopping experience in the centre more pleasant for all of our customers and for our staff. Retailers are very interested in becoming age-friendly. And the programme is very simple, and that's the beauty of it. It makes it very easy to become an age-friendly business.
We as a store have bought into the McDonagh Junction age-friendly training course massively here in store by implementing the low-level shelves we have in store, the bold print we have on our signage, and also having the staff trained and well aware of what the older people need in the store.
For the customers, we've over 300 members of our age-friendly club. So they really appreciate the measures that are taken and just the awareness with the staff in the centre that they're being thought about on a constant basis. We have rolled out age-friendly business accreditation training in Kilkenny to over 80 businesses across the city and the county as part of the Chamber of Commerce. And now we're working with Age Friendly Ireland to roll out age-friendly business accreditation to all the shopping centres across the island of Ireland. And that's something that I'm working on at the moment.
Two key initiatives promoted by the Kilkenny Older People's Council were the introduction of age-friendly parking and the Kilkenny City bus service.
Back in 2015, a priority of Kilkenny Age Friendly Older People's Council was that should include car parking facilities for older people, in other words, age-friendly car parking. So the Kilkenny Age Friendly Older People's Council collaborated with a Kilkenny local authority, the service providers both public and private, and indeed the Chamber of Commerce. And what has resulted is now we have in most of our car parks, public and private, thankfully, Kilkenny Age Friendly Older People car parking, which is very successful, run out very successful, and has been widely used. In McDonagh Shopping Centre, Marion Ackerman, who was very active with us in the age-friendly concept as well. We have age-friendly car parking there. Next to it we have age-friendly car parking in the railway station, McDonagh railway station, and just in front of it in John's car park opposite the church we have age-friendly car parking as well. And down just from us here at the Carnegie Library, age-friendly car parking, and in the biggest car park in the city, the public one, the County Council one, the Market Yard, age-friendly car parking too. And incidentally we have age-friendly parking at St. Luke's Hospital as well. So in a wide range of places, like you said, public and private, we have installed age-friendly car parking successfully. We're rolling out the age-friendly car parking as we speak around the counties as well, and it's already been rolled out successfully. For example, in Thomastown in Kilkenny, which is an age-friendly town, the age-friendly car parking is there in Market Street, in the main street there in Thomastown, and is widely used. And my hope would be that over the next 10 years, we'll see the spread of age-friendly car parking throughout not just Kilkenny City and County as well, but throughout the country. Kilkenny City is ideally suitable physically for the provision of a public transport system. We have 4 parishes, 2 at the east of the River Nore and 2 at the west, physically located very well. The older people, for some time now, and the Older People's Council had as one of their priorities the provision of a public transport system. We did a petition on the matter and got a huge response from each of the 4 parishes. So we acted on that, and in fairness we got the support of Kilkenny Local Authority. Transport, access and mobility are one of their priorities as well in their development plans. So we approached the National Transport Authority with success, and in 2020 our pipe dream became a reality. The response to the public transport system, I can say safely, has been nothing short of phenomenal, and it is the intention of the Older People's Council and the National Transport Authority to extend this transport system into the city environs with more buses now, such as the success of the facility.
The safety of older people, especially in their homes, is a key aspect of the strategy of An Garda Síochána, and their work ensures ongoing engagement with older people who live in both urban and rural communities throughout Kilkenny City and County.
An Garda Síochána as a policing organisation would be judged not how it treats the strong in the community, but how it treats the vulnerable. And the older persons are part of that vulnerable sector of society. It was very concerning in 2016 when the Department of Health published a survey that indicated the population of older persons were going to increase by 40% within 20 years. That put us in a situation where we had to position our service delivery to meet this demand on service. An Garda Síochána are meeting older persons at neighbourhood watch meetings, community alert meetings, and they're a representative part of our population. Feedback is taken from older persons to these meetings where local Garda management drive Garda service to meet the demand and the challenges that are facing older people locally. In rural areas, to meet the challenges of reaching out to older people, part of our communication strategy is through the local media. For example, local radio KCLR, all our broadcasting weekly messages include a message for older people. We're doing our best to reach into the homes of older people, particularly to convey the message of crime, community and road safety. Our particular concern of an organisation is to ensure that we reach older people and try and reduce the fear of crime, because that's the most significant part, I think, with older people. Never as a country have we been more connected with telecommunications, and yet never have people, so many, been living alone. So we want to reach those older people, particularly those vulnerable older people, and to reassure them, to connect with them, and to let them know that we're there and we're available if they need us. We're a caring organisation and fully understand how that can impact an older person, particularly a person who's living alone. And from our perspective, we want to reach out to older people, try and reinforce positive messages, positive community message, to make sure those people are connected not only with their own local community, but that they can be connected to in Garda Síochána, where they know that if there's any challenges or difficulties locally, rest assured they can contact their local Garda station, they can contact their local Garda and share any concerns they might have. That might be something at a very basic level, that they hear something outside or they hear noise in the backyard late at night. We ask that they don't hesitate to contact the local Garda Síochána, where we'd be more than happy to go out and talk to local people on a one-to-one basis and try and reinforce that safety message. We have Garda patrols, both marked and unmarked, all day, all night, 24/7, that are there to support and to help people, especially older people. I've been very fortunate to be part of the consultation group for the first older person strategy in County Kilkenny in 2011, when in a former role I give feedback on behalf of the Garda Síochána. I was quite lucky as my career progressed, and I genuinely mean to have a role with older people, to be able to make a contribution from a Garda's perspective. I was an age-friendly ambassador for older persons in County Kilkenny in 2015, and since my role as a superintendent and Garda manager for South Kilkenny, Thomastown district, it's fantastic to see the work that's taking place with older people, in particular the collaboration that's taking place with all government agencies and the stakeholder involvement. It's really an honour to be able to work for the betterment of life of older persons, to improve the quality of life. The Older Persons Council is an avenue where we can bring feedback in collaboration with other stakeholders, to work together, to make improvements, to improve communication pieces around the older persons, to look at the different ways we can help people, and equally, of equal importance, to listen to feedback from older people, that where they think the service should be deployed, how best we can meet the demands as a Garda organisation, and how we can face the challenges going forward ahead.
Many of Kilkenny's older citizens retain a zest for learning and education well into their later years through the work of Kilkenny Library Services and the Kilkenny Carlow Education and Training Board. Learning and education courses are available to older people across a wide variety of activities, including the growing area of digital learning.
Somebody once said, if you design for the young, you exclude the old, but if you design for the old, you include everyone. And that's something that we use to, I suppose, look at our spaces and make sure they're welcoming for all. Then we look at our stock and we make sure that our stock suits their interests. Have we enough large print? Have we enough books on CD? Is our music and our film collection suitable for older people? And we ask them that, we get their feedback on that. A simple measure we've introduced recently is a reader pen, which is simply a pen that reads text aloud for people. And that's really useful for people with, say, vision issues or vision problems. And then we come to our third main area, which is programming and events. And we run extensive programs of events throughout the year. And we try and make, I suppose, provide opportunities for people, I suppose, to participate and connect. And that could be a part of a book club, you could be part of a poetry group, part of a creative writing group. They might want to learn a new skill. It could be learning how to do a new craft like quilting or basket making, or learn technology. And we find that our role around digital skills is becoming more and more important for older people. We also try and introduce, I suppose, younger people into that equation, and we have a lot of projects where we have TY students who come and teach older people how to use the tablet or the phone, and that's an intergenerational programme, and everybody benefits from that, and it's really beneficial to everyone. I mean, here in Graignamanagh Library, our staff are trained as digital ambassadors, so people can come in and they can get one-to-one training on how to use, say, our e-books online, our e-magazines, our e-audio, and it's all for free. I mean, how do you make sure that you're serving the needs of the older population? You ask people, you ask them for what they need, and you react to what they ask you for. So I think our spaces will be vital in terms of being community-driven. That gap between the digital haves and the digital don't haves, if you know what I mean, just bridging that gap for people who might find it difficult to get on that digital journey, because a lot of people are still very feared of it, and I think the library service is an important role there as well.
The older generation are not
as technical, you know, as the younger generation. The younger generation it just comes as second nature to them, but not to me. So the library is a great help to me with my online banking, filling forms, getting passports, visas, travel documents especially.
The importance of funding learning opportunities for older people is a real part of community education here, both in Kilkenny and Carlow. Particularly in Kilkenny, we've worked with older persons groups and active retirement groups, and those, I suppose, learners who are returning to education after a lifetime of being at home, after a lifetime of working, and after a lifetime of giving to others. We're delighted to have many, many older learners and experienced learners coming through us. It provides not just a social outlet, but it provides an outlet for people to learn new skills, to, I suppose, pass on skills to their family, such as grandchildren. We've many classes in the community and in adult literacy, looking at crafts, looking at IT. We've family literacy programs where a lot of grandparents come to actually learn and pass on those educational literacy and numeracy skills to their grandchildren. I suppose the areas that are most popular in adult and community education are the adult literacy programs and are the community education programs. And you might say, are they one and the same thing? But community education really works with groups and adults through the groups who are most distant from education. Most distant in terms of transport, most distant in terms of accessibility, most distant in terms of maybe the person hasn't been in education for a period of time. And they can do anything from personal health, well-being, computer courses, craft courses, exercise and fitness courses. It's really on the group to actually decide what they want to do and come to Kilkenny and Carlow ETB to find a tutor. And Kilkenny and Carlow ETB can fund a tutor for a number of weeks to work with that group. And the importance is that it's in the local area. It's in the parish hall or it's in the GAA club. It's really, I suppose, education at the crossroads. In adult literacy, it's, I suppose, adult literacy. We have a new 10-year adult literacy strategy, which is a national strategy. And in Kilkenny and Carlow ETB, we realise the importance of learners, again, who are distant because they have barriers facing them. And those barriers might be literacy, it might be numeracy, or it might be digital literacy, and the use even of a new mobile phone can be daunting for some people. We have classes throughout Kilkenny to support adult learners in that respect.
Kilkenny's success on the hurling fields of Ireland is legendary. So too are the efforts of many of the county's older citizens, who strive to maintain good levels of fitness through a variety of exercise and leisure programs. We were on hand to capture their efforts at the Kilkenny Recreation and Sports Partnership organised activities at the Canal Square and at the Watershed. And we also visited Clara GAA Club, where we met members of the Clara Corja Club Canon Nolan Day Centre, enjoying the excellent leisure facilities at the club. We also captured the enjoyment of a retirement group at K-Bowl at McDonagh Junction. And we could not miss the post-event cup of tea.
We're here on Canal Square in Kilkenny City tonight for our Monday night walking group. The good thing about the group is that they all come together and they go on a walk that's provided by a walking leader with Kilkenny Sports Partnership. What we're trying to do is provide opportunities for people to be more active in their community. So that can take a variety of formats. So it can be from providing programs ourselves. It can be also signposting opportunities for people in their community, identifying coaches or tutors or walk leaders, identifying facilities, and it can also be signposting community groups towards where grant funding is available to support them being active.
We have active retirement groups in every morning and they're very welcome. So they come as an ongoing part of K-Bowl. So we bring them in, they have an hour's bowling and we give them teas and coffees and whatever they like, some biscuits and refreshments. And yeah, so that's what we do in the mornings for the active retirement. When I started in K-Ball, we didn't have too many active retirement groups, so we got involved with the programme with McDonagh Junction, and it's helped us immensely. So we have groups in every morning now, as opposed to before we wouldn't have had very many groups in the morning. We would have been very quiet. So now, as a result of joining McDonagh Junction in the age-friendly thing, we have groups in every morning that we have somebody in. The active retirement groups, so we love to see them coming in. They're so happy to be here. They tell us that they're great. You know, it's something to do in the mornings to get out of bed, come and meet their friends, and they look forward to it every week. And we love having them because they're so full of enthusiasm and they put the rest of us to shame, to be honest.
We're here on every Thursday from 11 to 12. We have an hour's bowling for some of our members. Great atmosphere, great facilities. We're well looked after, and there's a great meeting place, good social outlet for the lads. Most of the lads are retiring. We all have various ailments, you know, including myself. So it gives us that little bit of physical thing that we can do, and you'd be surprised how much exercise you do in an hour, you know. The social aspect is great because we can check in with one another how people are feeling and how our things are going, you know. Or we give our little medical reports of how we're feeling, and we have our little arguments on politics and sports. No, you know yourself. But it's great to meet up with the lads, you know. We have 3 different sections. We have the young boys, which are under 70. Then we have the old boys who are over 70. And then we have the departure allowance, which is over 80. So I'm on the first tier.
We all either are grandfathers, we're talking about grandkids, or talking about something, or talking about the hurling, or something like that. So it's a social contact. Our age group are getting scarce. A lot of the people that I work with are passed on. So these are a few people here that we have things in common. It's not the bowling. The bowling is a tangent. It gets us together. It's an excuse that it joins us together, just to wherever we call it. It's like a hurling match. Same thing, you go to a hurling match. The hurling match is a tangent.
Age Friendly Ireland asked all counties to nominate an Age Friendly ambassador during 2022, and that ceremony took place in Croke Park when we were all introduced to one another and we were given our certificates, as it were. Now, rather ironically, on the day that the Age Friendly ambassador scheme was announced and we were all appointed, Croke Park was announced as the first Age Friendly stadium in the world. Now, I was particularly chuffed about that myself personally, because I had started that programme with Age Friendly Ireland some years previously. And I suppose my role as Age Friendly ambassador is to support the Kilkenny Age Friendly Alliance, is to support the Older People's Council, and to act as their spokesman and PR person at any opportunity that I'm asked to do so. And that's something that I enjoy. And of course, the development of the 10-year book and 10-year video to commemorate 10 years of Age Friendly activities in Kilkenny, I've been involved in that as well. It's something that I enjoyed very much.
A question that springs to mind immediately is, where have the last 10 years gone? COVID-19 delayed the production of this video by 2 years, but we were determined to celebrate what has been a decade of major achievements aimed at improving the lives of older people in urban and rural settings in our county. We know that much more can and must be achieved. The Kilkenny Age Friendly Alliance and the Kilkenny Older People's Council, in conjunction with our many age-friendly partners throughout the city and county, are determined that the next decade will bring many more worthwhile initiatives, all aimed at making Kilkenny a great place in which to live and grow old.
There are a lot of very new issues that wouldn't have been considered when the programme started 10 years ago, primarily scooters, electric cars, their silence and having to be aware of them. Technology is also high on the older person's agenda now in terms of wearable technology, home security, also, I suppose, the withdrawal of customer services from places like banks and post offices. So the challenges are very different, and I would envisage that in 10 years' time the challenges are going to be different again.
We know from the people who come and visit our city and county, and the busloads indeed that park outside the castle, that there's quite a number of those that are older people, and they've chosen to come to Kilkenny because they know that we have a very accessible tourism offering here, and that they can enjoy and get around our city quite easily.
I'm a member of other groups, and they've come down to Kilkenny for their breaks and enjoyed it so much. You know, they felt that they were welcomed and looked after so well.
Well, we want to continue to strive through the Age Friendly Alliance to make Kilkenny the best place in the country for our citizens to grow old in.
After 10 years of our Age Friendly journey, a new chapter is opening. We have an opportunity now to extend our programme into the municipal district towns and villages and rural areas where 75% of our population live. Our vision has ambition. With the dedication and commitment of all service providers, supported by the community and voluntary sector, we can realise our vision that Kilkenny will be a great place in which to grow old in, to enjoy, and to be appreciated by all.
The big hope for Age Friendly is that people who are involved in making decisions today, where the concept of getting old may not resonate with them that much, that they will realise that someday down the line they will be older people, and that when they're just making decisions today, they're conscious of those decisions and the impact they will have on our older citizens. If they do that, Kilkenny, and indeed every other county around the country, will be a much better place in which to live and grow old.